Bismillahirrahmanirrahim. Welcome back, friends. Welcome back to another video lecture by Kami Microbiologist. Today in this video lecture we are going to see the hyperchromic related comments. In the previous videos lecture we talked about blood smear, we talked about anisocytosis, we talked about poikilocytosis, we talked hyperchromic, hypochromic, each and everything, and we also talked in some of the videos lecture we talked blood smear comments. So this is also the video lecture that is related to the blood smear comments, or we can say blood film. So in this video lecture we are going to cover hyperchromic related comments. So the first comment is about the hyperchromic normocytic blood picture. So in this case, when you see in the blood picture report, CBC report, when you see that the value of MCH and MCHC are get high, then we call it hyperchromic. And if you see that the MCV value are normal, so then the comment will be hyperchromic normocytic blood picture. Okay, next comment is hyperchromic normocytic blood picture with leukocytosis, leukocytopenia, or thrombocytosis or thrombocytopenia, and so on. When you see the like this comment, so you have to give this comment when you see in the blood picture report, means in the CBC report, if you see that the MCH, MCHC value are low, are high, and the MCV value are normal, and also the TLC are also high, so then we call it hyperchromic normocytic leukocytosis. If the TLC high, if TLC low, we call it leukocytopenia. If the platelets low, we call it thrombocytopenia. If the platelets are high, then we give thrombocytopenia. So this is how we can make the comments. The third comment is hyperchromic normocytic anemia. It means that in the CBC report, RBC value is low, MCV value is normal, MCHC value and MCH value is high. We call that hyperchromic normocytic anemia. In the microscopic field, when you see that RBC are low in number, when you count RBC are low, when you see RBC structure are normal, and you see that in the normal RBC structure there is a large pale portion is present, then this is called as hyperchromic normocytic anemia. Next comment is about the hyperchromic macrocytic blood picture, in which the MCH and MCHC value is high, MCV value is low, then it is called as a hyperchromic macrocytic blood picture. And in this case you will also see that in the field of the microscope you will see small RBC, and they have a large pale central area. And when you see and when you want to give comment like hyperchromic macrocytic blood picture with thrombocytopenia, thrombocytosis, leukocytopenia, leukocytosis, so that comment will be given when you see in the blood picture report, means in the CBC report. If you see MCHC, MCH value is high, the MCV value is low, the platelet value is high or platelet value is low, so then we give hyperchromic macrocytic blood picture with thrombocytosis or thrombocytopenia, or we can say that with leukocytosis or leukocytopenia if the TLC is high or low. Next comment is hyperchromic microcytic anemia. In this case, MCH, MCHC value is high, MCV value is low, RBC value is also low, so then we give this one comment. Okay, and in the microscopic field, RBC number is low, you count low RBC, you will see small size of the RBC, and in this you will see that a large pale area. Then we have another comment, hyperchromic macrocytic blood picture, in which the RBC, in which the CBC report have high MCH and MCHC value, high value of MCV, then we call it a hyperchromic macrocytic blood picture. And when you see that there is a thrombocytopenia, thrombocytosis means that it have a high value of platelet and high value and low value of the platelet, then we give thrombocytopenia and thrombocytosis. We give that value respectively. And when you see in the microscopic field, the RBC are larger, the platelets are also large in number, and you will see that there is a large pale center area. We call that hypochromic macrocytic blood picture with thrombocytosis or thrombocytopenia, leukocytosis or leukocytopenia. Next comment, we have hyperchromic macrocytic anemia. It means RBC are low, RBC value are low in the CBC report. The MCH and MCHC value is high, and MCV value is also high. Then we call it hyperchromic macrocytic anemia. And one thing more, in this case the RBC, when you see in the microscopic field, the RBC are large in size, and they have large central pale area, and the number of the RBC are also low. So this is all about the comments which we explain. Inshallah, in the next video we will see different microscopic fields, that how the normochromic, how the hypochromic, how the hyperchromic will be look like. So in the different microscopic field, we will also talk about different microscopic field in the next video lecture. So I hope this video is helpful for you. Thank you so much for watching.